Hi everyone, welcome to my channel. In this video we'll be talking about anemia. Okay, so one by one we'll be doing all types of anemia, but we should know first of all what is classification of anemia so that we can derive all the causes and treatment plan for all types of anemia. Okay, so let's see. So what is anemia? Basically it is decrease in oxygen carrying capacity of blood. This is really important, oxygen carrying capacity. So oxygen being carried out by RBC having hemoglobin. So many times student answer this question that decrease in hemoglobin is anemia, decrease in RBC count is anemia. No, it's overall oxygen carrying capacity of blood whenever reduced, it's called anemia, and cause can be decrease in RBC count or decrease in hemoglobin concentration. Okay, so how we can classify anemia? There are two type of classification of anemia. One is etiological classification, the etiology means based on cause, and other is morphological classification of anemia based on size, color of RBC, or basically based on morphology of RBC. Okay, so let's see how we'll write this question in exam and what are different classification under these two headings. So first of all, let's see about etiological classification. So etiology means based on cause, right? What can be cause? When there are causes which affect the production of RBCs. So whenever there is reduced production, okay, so what can happen during production? Whatever things we need, if those are sufficient, then there will not be any anemia. If they are deficient, that can cause anemia. For example, dietary deficiency, okay, or daily need we are not able to met. For example, like poverty. In case of poverty, when socio-economic condition is not good, then they are not able to take diet properly, okay, because of unavailability, right? So in those cases anemia is very frequent. Okay, examples you will be writing like iron. If iron deficiency we talk about, it's iron deficiency anemia. If B12 is deficient, then it is pernicious anemia. If B12 and folic acid is deficient, then it is megaloblastic anemia. Okay, next is chronic inflammation. In case of chronic inflammation, for example, chronic kidney disease, hypothyroid, or chronic infections, there can be anemia. Next is aplastic anemia, when bone marrow is not functioning well. So bone marrow, because of that disturbed growth of bone marrow is not able to synthesize the not only RBCs but all type of cells. So that is aplastic anemia. Okay, it can happen, the malfunctioning of bone marrow can happen based on some drugs, in some chemotherapy as well. Okay, next is if blood is lost. There is no problem in production of anemia, but blood is lost because of anything like hemolytic anemia. There are some causes which can cause hemolysis in our body, which is leading to loss of blood. There can be some abnormal morphology or cell shape of RBC which can lead to spleen become active and start destroying these cells. So that is sickle cell anemia. Like purpura, like blood loss, in purpura blood loss can occur because of platelet deficiency or capillary wall damage, right? There can be spleen is going to break all the cells. For hemolysis, spleen is responsible. If that spleen become hypertrophic, okay, so hypersplenism, if it can occur, it will start lysing more cells. So lysis of cell will occur. There can be parasite in RBCs like malaria, okay, which lead to basically when this parasite cell will go to spleen, spleen will break this cell. Okay, so these are some causes which can lead to blood loss via hemolysis. Okay, so abnormal cells when pass or cross through spleen, they will be broken down causing anemia. So these are some causes of anemia related to blood loss. So we have talked about etiological classification of anemia. Now let's see morphological classification of anemia. So morphological classification of anemia. Now morphology, so shape and size of RBC we are talking about. It can be based on two things. One is the size of RBC and other is color of RBC. So let's first see based on size how RBCs or RBC cell are classified as per the anemia criteria. So when the RBC size is normal but blood is lost, because of that blood loss anemia is there, so then normal size RBC will be there. Okay, the normal size 7 micrometer of size RBC will be there. For example, if there is any trauma or accident, or total blood will be lost, there will not be size will not be affected, right? So it will be called normocytic anemia. Fine, in this condition, then if the volume of RBC is less than 80 femtoliter, so MCV is reduced than normal, less than normal. In case of iron deficiency anemia, in case of chronic infection, or in case of thalassemia, it can happen. So we'll call size is reduced basically. So we'll call it microcytic anemia. Cytic means cell, micro mean less than normal. So microcytic anemia, normocytic anemia, and last is macrocytic anemia. Macro, as name shows, macro means size is large. So when the size is large, during erythropoiesis, if you know, the size reduce stage by stage, right? So when for example, bone marrow is hyperactive, so RBC synthesis is not happening properly, and bone marrow is like hyperactive, it's making, instead of 1, it's making 100 cells. So there is no time for all the cells to mature and go to bloodstream. So immature cells comes to bloodstream because of hyperactivity of bone marrow. So in that scenario, what happens? The size of the cells is larger, they are not mature enough. Immature cells are large. If you see, if you remember the process of synthesis of cells, so large cells come to stream or blood vessels. Okay, so we'll call it macrocytic anemia. Fine, immature big blast cells come to bloodstream, and cause can be B12 deficiency, folic acid deficiency. So in B12 and folic acid deficiency, the blood picture is basically macrocytic picture. Fine, in pregnancy, in alcohol abuse. Okay, so that is your macrocytic anemia. So macrocytic, normocytic and microcytic is the classification of anemia based on size only. What about color then? Color of RBC is because of hemoglobin concentration, and the best parameter to assess is MCHC. Okay, MCHC, mean corpuscular hemoglobin concentration. So that is based on MCHC value, or based on how much hemoglobin the RBC is having. It can be divided in 3 types: hypochromic, normochromic and hyperchromic. Look, the percentage is basically 32 to 36% is the normal value of MCHC. So whatever exists between this normal range is showing that hemoglobin is normal in amount in 1 RBC. So that we will call normochromic anemia. Normochromic anemia can happen whenever there is only blood loss. So hemoglobin is proper, but blood loss is there, right? Hypochromic is basically when less than this percentage, the hemoglobin concentration 1 RBC is having is less than this percentage. So that will be paler RBC. It will not be reddish color. Okay, it will be paler. So that will, MCHC is less than 32%. We will call it hypochromic anemia. So iron deficiency anemia and thalassemia are basically hypochromic anemia. We have seen these two terms, iron deficiency anemia for example, which is the most common anemia. If you see in blood picture, it will be hypochromic, means less hemoglobin concentration, and here we have seen it's microcytic. So the blood picture is microcytic hypochromic in iron deficiency anemia. Okay, when we talk about more than 36%, this hyperchromic picture we can't have. Why? Because more than 30% hemoglobin cannot be accommodated in 1 RBC. So this is not possible. Okay, so based on hemoglobin concentration, we have only 2 types, hypochromic and normochromic picture. So for example, when we talk about trauma or accident, the blood picture should be normochromic picture and normocytic picture. So normochromic, normocytic anemia in case of any accident, and microcytic hypochromic anemia in case of iron deficiency. And megaloblastic anemia, macrocytic picture in B12 and folic acid, and they will be normochromic. So that's all about classification of anemia. I hope the point is clear and you can represent your answer the same way I have written here. Okay, so we'll see you in next video, the classification of anemia. You can comment if you want any video, and you can subscribe my channel if you like my videos. Thank you so much for watching. Bye bye.